Hello. Good evening, fellow friends and loved ones. Yes, it's once again another opportunity to come to your homes this evening, the 17th of January 2021. Yes, 2021. It's once again a privilege to come to your homes to join in our weekly discussions. Yes, today is no exception. I'm sure we're going to have a wonderful time in our homes. Yes, unfortunately, we had to change our time to 7 o'clock because of circumstances beyond our control, and I'm glad to lead in the discussion, and I'm sure that we all enjoy the discussion. We would have a wonderful time. Yes, so want us to stay tuned and let's enjoy the discussions. If you have any question, you can join the discussion and ask. So today we're talking about a very important condition, and I'm sure you've been wondering about it. You were wondering what it meant. Yes, we put a very simple word for the topic, and I saw under the flyer there was a huge word under it. So we're talking about it today. So today's topic is finger stiffness. Finger stiffness. Yes. So another name, that's a scientific name, is called Dupuytren'S contracture. Dupuytren'S contracture. So it's a person who made it is called a Dupuytren, and then the contracture is stiffness at a particular part of the body where you find difficulty in moving that joint. So if you have stiffness in your knee, you can't raise it up or you can't bend your knee. So that is contracture. Contracture could be keeping a particular point of the body, that is joints of the body, at one place for a longer time, for about 6 months, without moving it. So this is called contracture. So the outline of the presentation is the topic, the incidents, the prevalence. We're going to talk about the causes, the clinical presentations. We're going to talk about some various treatments that are used to be able to cure or manage this condition, and then we're going to look at some lifestyle modifications about this condition. Yes, it's quite a not so common condition in this part of our world, but then it's something that could happen to anyone at any time. So we are zooming into today's presentation. It's titled finger stiffness or Dupuytren'S contracture. So one may ask, what is Dupuytren'S contracture? Yes, it's a benign myeloproliferative. When you say benign, it means that it's a minor condition. It doesn't really last for quite a long time. And when you say myeloproliferative, it means it's a condition that could aggravate, it could worsen, and it could cause some tissues to be affected. And it's a progressive disease. It means it doesn't occur at once. It's gradual. So you think, oh, the stiffness is small, but then after some time the stiffness grows into something we call contracture. That's when you can't even move the joint that we were talking about. And it's also a disease. A disease is something that brings discomfort to a particular part of the body. It's a disease of the palmar fascia, which results in shortening or thickening and fibrosis of the fascia and aponeurosis. Okay, so I'm sure these are big words, but simply put, they are shortening of a structure in the palm. So it mostly affects these two fingers, the small finger and then the ring finger. This condition affects the small finger and the ring finger. So we have these two fingers. So these two fingers are affected most. And most at times you have the short, that is the small finger, affected. So you can see the small finger like this, and then the ring finger like this. We'll see some pictures very soon to be able to give us a very detailed explanation of this condition. So there's a structure we call here tendon. So most of your fingers, or all your fingers, have something we call tendon, and the tendon helps us to close our hands and open our palms. Close and open. We have some in front here, and we have, I'm sure you can see, if you look at my finger like this, you can see some straight structure here. very thin. It's called a tendon. We have similar structures in front of my palm, also called a tendon, and that helps me to close and open. But in the case of this condition called Dupuytren'S contracture or finger stiffness, these two, the ones inside, the tendons inside, the ones that are here, you can see these ones here, the ones inside here become shortened. So they become short like this, and then this one too, the ring finger also becomes shortened. So most of the presentations look like this. And so then they can't open their hands, or they find difficulty in holding things or opening their fingers, and then other health related conditions. Okay, so it's actually a condition that brings discomfort in the palm. Yes, so people cannot be able to hold things very effectively, and so as we said, it mostly affects the fifth and then the fourth digits. The fingers are called digits in anatomy. 1, 2, 3, 4, 5. Yes, so the fifth and the fourth digits are mostly affected by this condition. And then this begins actually with painless. So you could, in some cases, the patient don't experience pain. So he feels some stiffness in the hands, he can't open the fingers well, but there's no pain in terms of opening. But then when the person doesn't take it serious, the disease, that is the stiffness, could increase and becomes more stiff till it becomes contracture, where movement of the fingers out becomes even more difficult. Okay, so we're talking about a condition called finger stiffness or Dupuytren'S contracture. Yeah, so this forms, actually, you could see in this condition, you could see something we called round spots called nodules, and the nodules form at this point, the small finger and then the ring finger. So these called nodules also makes this condition very, very easy to diagnose as Dupuytren'S contracture, and this form causes this deformity called the Dupuytren'S contracture. So when you see nodules forming, they mean that it's progressing into this condition called Dupuytren'S contracture, and therefore it's early diagnosed, and then better treatment is given out. So actually this condition is mostly seen in whites, as I said initially that we don't mostly see this condition in this part of our world called Africa. But then that doesn't mean that there are no incidences of such condition here. Yes, there are, but they are in a low key. And then this disorder is often bilateral. So when you say it's bilateral, it means it could affect both fingers or both hands. That is my palm. I can have these two of my hands form like this as Dupuytren'S contracture. But in the case where only one hand is affected, the research has shown that the right hand is mostly affected as compared to the left hand. Probably because they are more right-handed than the left-handers. That's my explanation. Maybe I stand to be corrected. Yes. Also, it is linked to, one of the researchers says that it's linked to a familial origin. So if your parents have it or your relatives have it, then it's likely that they can pass it to you through the genes of your parents or your relatives. Okay, so now we're looking at the clinical presentation of this condition. When you come to the hospital, what are we supposed to see? What are the visible signs? But before that, it is stated that by a researcher that it's a genetic disorder, as we said initially, that it's in the genes of our parents or our relatives, which are passed on onto us. And it's also autosomal dominant. That means that it can show up itself very, very visibly in our offspring or from our parents onto us. And it's actually initially less painful, but then it becomes painful when the condition is not treated very early. Also, some researchers have stated that it's associated with these conditions: 1, diabetes, seizure disorders like epilepsy, and then you could have smoking. So when you smoke a lot, you could have this condition called Dupuytren'S contracture. And if you have HIV too, you could have this condition called Dupuytren'S contracture. if you have vascular diseases that affect the vessels, you could have this condition also called Dupuytren'S contracture, or simply put, finger stiffness. So other researchers have also stated that there could be ectopic, that is, manifestations of this condition outside the region of these causes. We have some conditions such as, that is, leather host disease. So you could have this presentation, that is stiffness around certain joints, which could look like this condition called Dupuytren'S contracture. You could have some on the feet, that is the leather host disease. You could have Perron disease. So many diseases that could look like this condition, but then it's supposed to be in the fingers, especially these two fingers. Then we could say someone has Dupuytren'S contracture or finger stiffness. Don't worry, there are so many pictures that will be shown to you very soon. So let's keep on getting our information very, very, very intact, and I'm sure we will enjoy our presentation. Okay, so we look at some of the prevalent countries, that is, countries that tend to have this condition at a higher rate. We could have the Northern Europe. So North Europe, Europeans have it, that is Scandinavians. Also we could have the South Europe. So in general, Americans, that is South Americans, and then Europeans are most likely to have this condition called Dupuytren'S contracture. Not forgetting some Africans, because I said it's, despite the fact that it's non-prevalent here, Africans are also affected, but on a low key, and then Asians too also are affected, but on a low key. We said initially that the right hand is mostly prevalent in this condition, so it's affected at mostly the right hand. But in the case where one has this condition, he could also have it in both hands, that is this hand. So it presents like this. It's not able to open, especially the small finger and then the ring finger. And other researchers also state that males are more predisposed to this condition than females, because it's said that males are more active and they perform hard labor as compared to females. That is a research carried out by some unknown researcher. Okay, and it's also stated that people of young age have this condition, but then it's on a low key, because most people, or most young children, that is young adults, don't engage in very physical activity as compared to middle-aged individuals who are involved in more active exercises or active work. Okay, and then it's also stated that by researcher that people have it at a younger age, but then when they don't take it serious and they grow up, the stiffness becomes very serious, and then you could have this condition called Dupuytren'S contracture. Okay, so let's take a short break and let's look at some of the pictures of this condition we are talking about. Okay, so we can see it from this angle. Yes, so you can see the finger here. Yeah, you can see the finger here. I'm sure we can appreciate it very, very, very well. You can see someone's finger here. So we can see written the symptoms of this condition. You could see the nodules formed here. So these are the nodules. You can see this rounded structure here. I told that it's formed mostly in the the third finger. Okay, so let's reiterate our point that it's formed in mostly the third and the fourth finger, that is digits. And so we have nodules forming here, and then the nodules, that's the rounded structures here, become thickened, and then become stiff, so you're not able to move these structures there. Okay, so this finger and this finger are mostly affected. The third and the fourth finger, let's keep it in mind. Very importantly, anyone who asks you this question, you can answer it. It's mostly affected in the third and the fourth finger. So the middle finger and the ring finger, not the ring finger and the small finger. The middle finger and the ring finger. So let's keep this in mind. And so we look at some, so you can see the palpation, the physiotherapist palpation the side, so checking whether we have stiffness around the side. You could see this very visible here. You could see the shortness and then the nodule forming around the side. Yes, so you can see it's very, very visible here. So you can see most permanent structure that is affected is the ring finger, but it extends to the middle finger. And then in the cases where it becomes very serious, you could have the other fingers being affected, but most prevalent part of the fingers are the ring finger and the middle finger. Okay, so let's look at some more pictures. Yes, so this gives us a very, very good observation. So you can see this structure here. You can see the Dupuytren'S structure forming in the ring finger. Look at how long it is. Yes, you can see how long it is. Yes, I'm sure you can appreciate it the more. You can see this one too here. So this is called the Dupuytren'S contracture. I'm sure you have a very good visible understanding of this condition, Dupuytren'S contracture. Let's look at some more conditions, some presentations. Yes, you can see this here. You can see the nodule here. Yeah, a very visible one here. Yeah, I'm sure you can see it's very rounded here, and it can become very stiff. Actually, it becomes very stiff. It's very painful. Actually, you could have stiffness at an early stage, but if you don't take it serious, it becomes very, very, very serious, and you can't even move your fingers. So this is one of the worsening stage. You can see the small finger. Yeah, it's very, very bad, very, very bad. The small, very, very bad. Yeah, and I'm sure you don't like to experience this, because treatment becomes very difficult when it's not noticed early and you keep it to yourself. Moreover, it's a structure called a tendon, and tendons, when they become very stiff, it becomes difficult to bring them back to their normal state. So it's advisable for early treatment. So there's another picture. Yeah, another picture. Okay, you can see that's very, 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 very visible here. Okay, so you can see here, look at, wow, look at how stiff it is. Yeah, look at the small finger. So the small finger is also liable to have this condition. It's very, very, very bad. Actually, you need to report to the medical doctor or the physiotherapist when you notice this condition in your finger. It's very, very important. So this is at early stage. You can see that at least you can observe some movement in the finger. So there's a likelihood of having this condition being treated and the person recovering fully. Yes, so this is a very serious stage of this condition. Another one. So I'm sure we are having a very good understanding of this condition by this pictorial presentation. Yes, so this is very serious. Yeah, the worsening stage, it can be very, very serious. Look at the swelling, the hand swollen. Wow. Yeah, we can show you more pictures of this condition. More pictures. Yeah, more pictures of this condition. Okay, so we are going to continue the discussion. Okay, yeah, so I'm sure we've seen a lot of pictures. I'm sure we have this very, 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 very I don't know how to say it. Very, very awkward condition, because if it happens to right like this, it becomes difficult, and even treatment becomes difficult. It could result in psychological trauma, because you don't feel comfortable around people, and you don't feel like you have the same fingers as they have. And so its early treatment gives us a very good outcome. Okay, so we continue. So actually there's a structure in our body that we call collagen, and collagen is very important. That gives us strength into our structures we call ligaments or tendons. So we have so many types of collagen. We have type 1, type 2, type 3 collagen, and these also help to be able to give strength to our tendons and the ligaments. And so in the case where we have them being affected by this condition, which we mentioned earlier that it could be genetic, we could have one of the collagens being affected, yes, and then we could have the shortening of this condition called Dupuytren'S contracture. And so when this condition happens, the initial stage is it's quite not so serious, and it's called the proliferative stage. And this is called, can be stiffness, discomfort. Actually, there's no pain at the earlier stage. That's the proliferative stage. And there's actually shortness of the structure, we call the tendons here. But then you could stretch and it comes back, it goes back and goes forward and goes back. But then if you don't take it serious, then it could move on to another stage called the involution stage, where then stiffness becomes more, and then you could see the nodules forming around the first finger, the fourth finger, that's the ring finger, and then sometimes the middle finger. And so we need to take care of this condition and then report as early as possible. So we want to state some facts about this condition, that the disorder is not always progressive, that this condition is not always progressive. But then, as we've been saying for some time now, if you don't report early, then you could likely have this condition being worsened, and then this condition can be very disastrous, yes, where you can't open your fingers again. And also we could have several cords being affected. That is, you could have it extending from the small finger to the ring finger to the middle finger and then to the other fingers when not treated very early. We have so many types of cords that are formed. We could have the pretendinous cords, we could have the natatorial cords, we could have spiral cords. These cords are as a result of the shortening of the structure in the finger. So the small finger becomes shortened, the ring finger also becomes shortened, so they look like this, and then you're able to carry out your activities daily. So we are looking at some of the risk factors to this condition. What are some of the risk factors to this condition? 1. If you're a male. So we say initially that the males are more affected by this condition than the females. So one of the risk factors is that if you're a male, you're likely to have this condition as compared to the female, because males tend to work more, or they engage in activities that involves their hands the more. And also if you are 50 years and above, so when you're 50 years and above, because of the fact that you're unable to produce hormones, you're unable to produce, as we mentioned earlier, collagen, then movement in the fingers becomes limited, and therefore you could have this condition called Dupuytren'S contracture or finger stiffness, especially in the small finger, the ring finger, and sometimes the middle finger. Also, it could be bilateral, it could affect both hands. Also, it could be familial, that is, if your mom or your dad or your relative have this condition, you could have this condition called Dupuytren'S contracture. So let's look at some of the clinical presentations of this condition. It occurs slowly and typically progressive over time. That is, as time goes on, it becomes worsened. It affects people of European descent, that is, those who are living in Europe, and then those who are living actually in America, South America to be specific. The condition results in stiffness in the joints, and then other presentations such as we having been affected by both hands. So when the patient or the person comes to the hospital, what do we see? Okay, so we see that the skin becomes shortened, so the fingers become shortened. We will see nodules, that is nodules around the side. That's what we saw initially on the slide. Okay, we could have pits, so we could have, if you see the finger, we could have pits in the hands like this. Yes, pits in the finger. That shows that the person could have Dupuytren'S contracture, and then through other tests we can be able to diagnose this condition. Also, the person could have he might not be able to place the palm on the table like this. So if the table is this, or the person cannot place the hands fully on this, the hands becomes like this. So he places the hands on the table like this, and then the two fingers become hanged on the table. Okay, so then we've talked about some of the symptoms, the presentations, the causes, the prevalence, the condition itself. But then how do we diagnose this condition? How we tell that this condition is person has finger stiffness, which we now know is a contracture, that is very, very stiffness in the small finger and then the ring finger. How do you know? We can tell it through doing diagnostic procedures called X-ray. We could have laboratory tests done to rule out diabetes, because as we said, some of the risk factors are due to diabetes. So if the person doesn't have diabetes, it could be that the person doesn't have the condition called Dupuytren'S contracture. The person could also do ultrasound, and this could show how thick the tendon is. That is by seeing through an ultrasound. So after doing all these diagnostic procedures, what are some of the conditions that could look like this condition we are talking about called finger stiffness, or scientifically Dupuytren'S contracture? 1. Stenosing flexor tenosynovitis. It's a condition in science, yes, and you could have inflammation of this condition. That is, there could be a condition that could affect the small finger and the ring finger, but then there could be swelling, and if there's swelling, it could mean that it might not be this condition called Dupuytren'S contracture, because there is no too much stiffness, but there is movement, and so this will rule out that it's not this condition. But then if we don't see that as that, then we can say Dupuytren'S contracture. We could have ganglion cysts, we could have soft tissue masses. So these are some of the conditions that could look like Dupuytren'S contracture. So after ruling out or taking out all these conditions, then now we treat. So how do you treat this condition? First of all, as physiotherapists, we use various papers or various questionnaires called the outcome measures. Then as we treat the patient, we can observe how the fingers are improving in terms of opening up and then functionally using the fingers. Okay, so we have a very standardized outcome measure called the DASH questionnaire, or the quick DASH. So it's called the disability of the arm, shoulder, and then the hands. And these we can observe as time goes on the improvement in the fingers. Okay, so when we look at the treatment, so how do you treat this condition? Medical management. First of all, we could use medication. That is, if there's pain, the person can take in pain medications. But then there are other treatments that we could offer up. That is by through physiotherapy. That is, we could use ultrasound. That is to help to relieve stiffness in the tendon, because the tendon is a very hard structure. It's not like ligaments that we could stretch, but the tendon is very stiff. So the ultrasound helps to relieve the stiffness in the finger. We could also use hot pack, that is heat around the side, to relax the structure there. We could do stretching exercise. So if they're stiff like this, we could stretch the fingers like this and open up like this. So we are opening up the fingers like this. If it's stiff like this, open up small, gradually open up. So this helps to stretch the tendon around this side, and also to relieve the rounded structure we call nodules, and help to move the fingers very well. We also have corticosteroid injection. That is, the doctor gives injections around the hand, yes, the arm, and this helps also to improve the level of movement in the fingers. Okay, so apart from this, we also could do radiation therapy, but then this option actually is less taken into consideration because of other complications that could result through radiotherapy. Okay, we also have another procedure we call needle aponeurotomy, where we could have pins and needles around the side to relieve the pain. Okay, so this helps also to improve the function of the joint. So we have other medical options. We call the collagenase injection, that is injecting this region around the joints, that's the hand, to relieve the pain. We could also have surgical fasciotomy, that is removing the fascia, that is a structure just under the tendon, and this helps to move the finger very well. Okay, so these are some of the surgical procedures we could do. We could also do in surgery, we could do total palmar fasciotomy, that is removing the whole fascia, that is the structure that covers the tendon here, that makes it stiff. And this also helps to improve the function of the fingers, that's especially the small finger and the ring finger. So some of the therapy also that we could use in terms of physiotherapy is paraffin wax bath. So we put the hands inside the paraffin wax bath. It looks like candle wax. So these help to relieve the stiffness in the fingers, that's the small finger and the ring finger, and sometimes the middle finger. We could also do stretching. So we also encourage the person, the patient or the individual to be constantly stretching the small finger and then the ring finger. Though sometimes it's very difficult because at that point in time it has become very stiff. We encourage at least minimal stretching. Every 5-10 minutes we stretch the fingers a little because the tendon, and therefore we want to avoid contracture, that is non-movement of the fingers at all. Okay, so without much ado, we bring to end the presentation for today. We talked about finger stiffness, or we say Dupuytren'S contracture. So before we go, let's refresh our mind with some of the pictures again. Then I'm sure that we will draw the curtains to the end of the presentation. Okay, so yes, so I'm sure we can see again, so that I will not forget the picture. Yeah, so we can see the finger, we can see more, we can see this is the physiotherapist working on the person with the Dupuytren'S contracture and stretching it down. So I'm sure we can see it now, very visible. So this is a surgery that has been done to correct this condition. Yes, this surgery is very also good. It's very. So you can see more pictures. So this is called a wrist, and this also helps to hold the wrist in place. This is a surgery done, so you can see the stitches formed around the small finger and then the ring finger. So we could have tendons taken from other parts of the body and then also putting it at this part of the body so that we can stretch it, because at that point in time it becomes stiff. So in order to ensure movement in this part of the fingers, as the ring finger and small finger, we do a surgery to relieve the stiffness there. Okay, so I'm sure we can see more pictures. Yeah, more pictures. So this is it. So these are some of the exercises that the physiotherapist goes through. Okay, all right, so more pictures. Okay, so I'm sure that we have a very good understanding of this condition called Dupuytren'S contracture. Yeah, so we are very glad that you have been able to make time and then stay on course to the end of the presentation. Yes, I'm so glad that we've had this wonderful time here. Okay, so without much ado, I hope you have any question. Let's look at if you have some questions. Yes, so we can see Valentine, Sam, Randy, Askandari, Tayo, Flevi, Noble, David, Nanajwa. Yeah, you can see so many people online. Yes, so many. If you have any question, I saw Askandari as a question. He said, "Thanks, quote. I have really learned something today. But do you know by chance the name of the gene responsible?" Yes, for this condition, it's an autosomal dominant gene. I'm sure he's more of a biologist or probably a chemist. I stand to correct it, Askandari. Yes, so it's actually an autosomal dominant gene, so it shows itself and it can stay within the parent and it can be transferred onto the next parent. But the gene, I'm sure we'll look it up and then paste it on the Facebook for the particular gene. Or yeah. So if you have any question, you could forward it up to us and then we could answer you accordingly. Before we talk about next topic, yes, I'm sure we've learned a lot. Yes, we've learned a lot, and we want to teach other people. Okay, so without much ado, our next topic is a very interesting topic, and I'm sure we'll all be able to share our ideas and then give all that we've learned out. Okay, so actually our next topic is called pneumothorax. Pneumothorax. Yes, I don't give you a hint. It's a lung condition, so it's around the lung. We talked about bronchitis last time. I'm sure you remember bronchitis. Yes, and this is a brother of bronchitis called pneumothorax. So catch you next week as we discuss this condition, and I'm sure we learn a lot. Yes, may the Lord be with us. So have a blessed week. Have a wonderful week. Take care. Bye.